Okay, so I started the recording. Hi, Henrietta. My name is Megan, and I'll be performing
Okay.
your interview today.
Okay.
Can we start with you telling me about yourself?
Oh, sure. Um, you already know my name. I'm Henrietta, and I started working with people with the vulnerable population for 9 years. Then I just liked what I saw, and I said, well, let me go into nursing, and I did my RN. I went ahead, did my bachelor's, then PMHMP, which is psych. So I was, as a nurse, I worked with a psych population, schizophrenia and all, Alzheimer and all these things. I just had passion for what I do. So that's why I came into the career. And I'm somebody that I love what I do. I love people. Um, I'm very emotional. I That's all about me. Yeah,
Good, good, very
yeah.
good. All right, and so what made you
hmm
choose this career track?
Um, like I said before, I worked with people vulnerable for 9 years before I became into nursing, and I actually work on the when I became a nurse, I worked with the I did med surg, I did other areas, specialty that had to pertain with nursing, but I chose psych because I just had, like I said, I just had passion. If you have passion for what you do, it draws your attention. So um, I just love it and I'm dedicated to it. I also want to take it to the next level in the community and see what I can do to help take people out of the street and with my knowledge and just see how the community will make a better place. So
Great, good. And what attributes do you think you have that will help you to be successful in this position?
mm, the attributes I have is I'm comfortable with what I do. And I like I said, I love people. I'm a dedicated worker. Um, I love like I said, my I draw my attention with what I love. So the attributes I mostly have is I have this empathy, like especially with people with the psych. When I see what's going on, I'm just drawn to it. I see what I let me go back to school and see what I can really do to help my community, like I said. So those are my attributes. I'm just dedicated to take it to the next level. So yeah.
Good. And how do you think a friend, a professor, or a supervisor who knows you well would describe you?
I'm calm, loving. I have passion for what I do. I'm a dedicated worker, problem solver, risk taker, with a sense of purpose and humor.
Very good. All right, well, thank
Yeah.
you very much for this interview.
Thank you.
All right, so now we'll switch roles.
Okay. So, hi, Megan. How are you today?
Hi, I'm good, thank you.
So, I'm going to be interviewing you right now. So you ready?
Yes.
You're ready. So, I have some. So, the first thing I'm going to ask is just tell me about yourself. So, I just
Sure.
like to know more about you. Yeah.
Okay. I've been a nurse for almost 20 years. My background is mostly in critical care nursing. I've worked in larger cities at teaching hospitals, and I've really worked with a large group of different patient populations. Um, I have traveled from Boston, worked in Boston for about 6 years. My husband's job moved us to New Mexico, so I worked in a busy downtown hospital in Albuquerque, New Mexico, in an ICU, and moved back home to Massachusetts probably 5 years ago, where I work in a smaller community hospital now in the recovery room. So I've had a lot of nursing experience that I've been able to apply critical thinking skills and a lot of teamwork, a lot of organization. But mostly I've really enjoyed the critical care part of nursing and just the intensity of it.
Okay. So why did you choose this career path?
So I chose this career path after the COVID-19 pandemic, actually. I was very frustrated with bedside nursing. I actually got floated back to the ICU from the recovery room during the pandemic and took care of obviously very sick people suffering from COVID-19. Meanwhile, at home, my family was struggling kind of with their own mental health struggles. I have 3 kids, and they had a lot of anxiety, depression throughout that time. I started looking into getting them some help, and it really opened my eyes into how what a need there is for mental health care. I also was kind of thinking that I was ready to take a step away from the bedside and wanted to pursue my education a little bit further. And this just seemed like the perfect opportunity to do something different, but also learn a whole new role that a nurse can have, and know that there's a huge need out there for it. So, and also, even though I have no direct psych nursing experience, there's so much psych nursing that's involved with all nursing. So building relationships with families and providing, emotional support throughout stressful times to both patients and families, and really just working again with different patient populations. I really love the human side of nursing and the people part of nursing. So this just seems like it's going to be a really good fit.
Okay, good. In what type of work environment are you comfortable?
So I really like a busy work environment. I think that again is from my critical care days, just always on the move and always lots to do. I really enjoyed the community health side of mental health nursing. I've done one of my clinical rotations in a very busy community health center in a city here in Massachusetts, and it's just been really, really awesome. I've loved it. I've loved the patients, the patient population, how many patients we see in a day, how many patients are suffering from all different types of disorders, whether it be schizophrenia, bipolar, some come in manic, some come in depressed, some come in just looking for someone to talk to. So I think that is where I thrive, is where things are a little bit on the, I don't want to say hectic, chaotic side, but a little bit. I do think that I tend to find I can make a chaotic environment a little bit more peaceful. So
Okay, good. What attribute do you have that will help you be successful in this position?
I think my empathy, my compassion, and like I said, my love for just the human being. I do have a lot of compassion for people in general. So I think that's going to be very helpful. And also my critical thinking skills will help with the diagnostic part of this position. And my experience, again, just taking care of all different walks of life. I think that will also help me to be able to relate to a lot of different types of people.
Okay. How do you think a friend, professor, or a worker would describe it?
I think they describe me as passionate, dedicated, trustworthy, a hard worker. I give my all with every nursing shift I've ever worked. I'm there to work. So I think they would describe me as a team player and someone that you can rely on.
Okay, good. Thank you so much for the interview. I really enjoyed it.
Thank you very much.
Say have a good day.
Thank you, you too.